My name's Naomi Litchfield. I'm Director of Patient Advocacy at Bionical Emas. We're a leading global early access provider, and we're proud to incorporate the patient voice into the design and delivery of our early access programs. I'm very privileged to work with rare patient groups like Beacon, and my background is paediatric clinical research nursing. So again, I'm very privileged that I've administered investigational medicines to rare patients and seen the impact that it's had on their lives. I've also got a personal connection because my younger sister gained early access to investigational medicine that saved her life. So I'm extremely passionate about early access education, and I'm honoured to be here today to introduce you to Meryl Chambers, who is an inspiring mother and chair of Soft Bones UK. And she's kindly come here today to tell us about her rare journey as a rare parent and her perspective of navigating gaining early access to an investigational medicine for her son Maddox, who's been diagnosed with a rare bone disorder. So welcome, Meryl. Thank you so much for joining us. Don't underestimate the amount of effort that it's taken her and the long journey to get here today, so thank you. Please may you start by telling us all about Maddox, his diagnosis, and what treatment options you were originally offered.
Yeah. Can you hear me okay? Yeah, all good. So firstly, it's a pleasure to be here today and also to share our story. When Naomi asked me to speak, I really had to think right back because although it was 11 years ago now, we were first kind of in the midst of it all, and so much has happened since then. So my first child, Maddox, was born on the 9th of April 2014. It was an uneventful pregnancy, birth was absolutely fine. We stayed in hospital for 2 nights for support with feeding, and then we were discharged home. We had lots of people come and visit us, which was amazing, but we all noticed little things about Maddox that didn't seem quite right, but obviously he was our first child, so we were kind of going with it. He had the checks with the medics before we were discharged. I noticed that his legs were bowed. My friends had noticed, they're all nurses, he was struggling with feeding. And I remember me and Maddox's dad sat up with him on our chests all evening because he was really uncomfortable. And looking back, I'm like, that wasn't normal, but that was our normal at the time. He was in pain, and what we didn't know at the time was that he broke his ribs and wrists during birth. It was the following morning and he vomited up blood, so obviously we're in panic mode and we were transferred, readmitted into hospital. And then he started to deteriorate quite quickly, so he was struggling with breathing, he was struggling with feeding, and they were treating him for a chest infection. So we thought, brilliant, we know, what's going on here. But he didn't get better, so following the treatments, they started to look at kind of what else could be going on. And I remember the cardiologist come round and doing some tests, and they're like, oh yeah, his heart's fine. And in the background, they were doing lots of other tests, so blood tests, looking at x-rays, looking at various scans. And one day my friend came to visit us, and again, she's a paediatric nurse. I'm really fortunate, and all my friends are nurses. And she said, he's not right, Meryl. He's not well. And I was like, this is a good day for him. And it was then they put him on a pressure of oxygen, and the consultants came round when she was there, and they said, we're looking at underlying bone diseases. And they weren't going to tell me what it was, but I said, if you don't tell me, I'm going to look at them all. So they gave him a probable diagnosis of hypophosphatasia, shortened to HPP. So what that means for Maddox is that he's lacking in an enzyme which is in control of the mineralization of bones, and they described his bones as kind of moth-eating. So we were given that diagnosis, and then it was, what do we do now? So the consultants at the time spoke about palliative care, and I remember that the NICU team came round, and I said, I'm not going to cry.
It's okay, no. It's fine.
The NICU team came round and they took his hand and footprints. So obviously it's a really scary time for us, and we were, this is our baby and we want the best for him. So we were doing lots of research, Googling, trying to figure out what we can do for him to improve his condition. And it was at that point they spoke to a specialist at Great Ormond Street Hospital who had heard of a child with the condition in Manchester.
So Maddox was diagnosed at 9 days old, is that correct?
Yeah.
And at that point, you were told it was palliative care, and then you were Googling and researching and trying to find research centres. Was it 3 research centres?
Yeah, so there are 3 specialist centres that we heard about that were treating for the condition, so early access to investigational medicine. So they were Birmingham, Manchester and Sheffield. So it was at that point we were in contact with them just to see whether we could gain access for our son. And no one could really tell us about what the medicine involved. So that was quite scary at the time, but it was either that or palliative care. So we made the decision to move to Birmingham and gain access.
Amazing. That must have been a really scary and challenging time. And do you remember the informed consent process, like going through risks and benefits and what this investigational medicine was and how it was going to be administered, and the fact that it might not be approved because it was investigational and it might not be reimbursed? Do you remember what happened and that kind of time and moving hospitals to get that early access?
Yeah, so it was, obviously we were in the midst of everything, so we just kind of clutched on to a bit of hope. There's this medicine that we can gain access to, but we didn't really know anything about it, and his consultant at the time couldn't really tell us anything about it because there wasn't a lot known about the medicine. It was fairly new. When we were transferred to Birmingham, they'd not even treated a baby with the condition, with this medicine.
And Maddox was the first baby?
He was the first baby in Birmingham,
and he was 3 weeks old?
3 weeks old when he started the treatment. But after a couple of weeks, you could see the difference in him. Like, it was incredible. I remember being transferred to Birmingham, and at the time I thought, have we made the right decision? Because we were supposed to be going on the Monday, and then there was a paediatric intensive care bed available on the Saturday. So we were just blue lighted up. His dad was at work. I was just with Maddox. He was taken away from me. I was in a parent's room on my own. And I thought, why have we done this? But as soon as we got there and he started the treatment, and we could see the differences in him, it was a no-brainer. There was no other option.
Wow, so that's remarkable. So it ended up being life-saving for Maddox.
Yeah.
And was there any steps that could have been taken to help with communication, or would have made that journey a bit more positive? And was there any resources that you wish that you'd been given to understand what early access was, what investigation medicine was?
So all I remember from at the time of admission to Birmingham Children's is I sat down with the health professionals and we were going through consent, but a lot of it was medical jargon, and I think it would have been really useful at the time to have something like accessible information, videos you kind of can drop in and out of when you're ready to, information that's easy to read and that, as I said, you can go back to. And I know that you've got those resources now, haven't you?
Yeah, we do. We have some videos and an early access guide that we're fortunate to have collaborated with another pharma company on our resources page on our website, and also Beacon do too, so check them out if you are interested. And also, how is Maddox doing now? I'm sure everyone's wondering. So he's 11. How's he doing? And how's that been, the continuous access to the investigation medicine? Because that was a long while before it eventually got approved and reimbursed, which I know you were a part of.
Yeah. So I wasn't really aware of the whole kind of process. We gain access to this medicine, it's working for him. I had no idea about the process and that it could be taken away from him. I wasn't aware of it until I was in contact with Metabolic Support UK.
Kirsty's here, the CEO today. Can you speak to her?
Who were then climbed. So they asked me, so this was a long time later, a year and a half later, we were discharged home, and they contacted me to fill out a questionnaire about our experiences with HPP and what it meant for us. And then they asked me to be a patient representative alongside them in the NICE process. So I was able to be a part of that and share our story and how amazing this drug is and how life-saving it was for my son. But going back, Maddox is 11 now, and he's just started senior school, and he's football mad, and his team is Man U, so he'd be really jealous that we stayed in hotel football last night opposite the Old Trafford. So, yeah, he's crazy, and he lives a normal life, yeah.
Amazing. And he was on weekly injections, and that was quite cumbersome for him and burdensome because he has to inject in the same places and try and rotate, and the skin's quite hard.
Yeah.
And it's been moved now to bi-weekly, is that correct?
Yeah, so initially we were on, it was 3 injections per week, so it was quite traumatic for him. He's much better now than what he was, but there was one stage where we had to pin him down. But 3 injections a week, and it's now gone to bi-weekly, and what a difference that's made to him. It meant for him last year that he could go away on his school trip, and I didn't have to come and inject him. So obviously he didn't want me there, did he? Oh. So it made a massive difference to him. His mental health and also physically, the injection sites are not the best. So not having to inject him as much has been amazing.
Amazing, and it's incredible you got to share that on behalf of the HPP community at NICE. Is there any advice that you'd give to rare families going through the NICE appraisal?
Yeah, so reaching out to other organisations that have been through the process. I mean, we were really lucky because metabolic support have been so amazing throughout this whole process and really in supporting our families. So we were lucky to have them. But yeah, if you're able to reach out to other patient organisations that have been through it and speak to bigger organisations that are part of it as well.
Amazing. Yeah. Well, Kirsty's here today, but also you set up the first HPP soft bones patient group in the UK. What inspired you to do that, and how's that been?
So I remember having a conversation with Maddox's consultant, and he said there's no specific HPP group and we really need it for our community. And then it wasn't until kind of later on when I was involved in the NICE process, and I spoke to the CEO of the Brittle Bone Society, and she invited us to one of their patient days, and it was just amazing to see patients, families together, having the best time, sharing experiences, knowledge, learning from one another, and I thought, well, that's what we want for our community. So that was the reasoning behind setting up Soft Bones UK. Obviously, it is a challenge, particularly since COVID. We've struggled with life commitments and trying to do all that we can, and you feel the burden of that on you, really. But yeah, the whole reason behind it is to bring families together, and we've got a website and we've got a Facebook group who people communicate through.
Amazing, thank you for sharing that. And finally, is there any other advice you'd give to any companies in the room that are thinking about setting up an early access programme? Any healthcare professionals in the room that are thinking about requesting an early access to investigational medicine, or any other families that potentially early access might be an option for them?
I think for companies, patients obviously need to be at the forefront. So if you can get in contact with patient organisations and work with the consultants as well, the consultants obviously need to make patients aware of not only treatments that are available now, but in the pipeline, what's coming. And for patient organisations to just trying to reach out and attend these events and talk with other people that have been through the process.
And any other families, and you very kindly said that you're happy.
Yeah, I'm happy to chat to anyone. If anyone's got any questions for me, happy to answer them in the best way I can.
Of course. Well, thank you for coming here today and sharing your personal story. And yeah, it's been really invaluable. I hope everyone's found it really interesting. And if there's any questions from the audience, Meryl's happy to take them. So yeah, thanks for listening.